My friends, I'm very, very happy today because I think I have a very important message. I keep on researching things. I always reading. I always trying to find out, and at the same time, I'm reflecting of 50 years of medical experience, what I have lived with, what I have seen. I have many fellow physicians I talk to every day. I have fellow physicians that live far away, like in other countries like Colombia or Spain, but also in Japan, in South Korea, in Europe, many places in Europe like Italy and Switzerland and Germany and the Netherlands. So it is a constant talk about what you have found, what are you dealing with, what are your problems as a doctor, because by solving my problems as a doctor, I know I can help you. I am Dr. Rodrigo Rodriguez, and I'm with you like every Friday night through Truth Be Told Radio Network at 7 p.m. Eastern Standard Time. And then we repeat the program every Saturday morning at 9:30 Eastern Standard Time, and you can watch it. But if you miss it for any reason, if there's something you can listen again, if there's something which I would love you to do, share it with somebody else, you can go to Spotify and search for Truth Be Told Radio Network. We're also on all the social platforms of this day, Twitch and Twitter and Facebook and you name it. There's so many, Instagram, that I'm beginning to lose count. And of course, YouTube, where we have our own channel and you can watch all these programs. But Spotify is simple. You just search for Truth Be Told Radio Network, and you're going to have over 100 hours of programming like this. And as I was telling you to begin with, I search and read and look for programs. I'm a doctor. I talk to patients every day. I sit with them. I see their suffering. I talk to their families. I see their problems. And so many times, you hate the fact that that this person is suffering, that the family is suffering, and you say, what can I do? And one thing I learned throughout all these years is that you do not necessarily have to write a prescription. You can do many things. Actually, you can do many things. You can take over of part of your medical treatment, over part of your medical conditions, and you're going to not only be helping the doctor, but you're going to be helping yourself, because we can shorten the length of a disease. We can improve the results. We can make the therapies we're getting a lot more efficient. So why cannot do it? That's my point of view. Why can I do something simple to help myself? And in the process, I'm going to help my condition. I'm going to have a shortened period of disease. I'm going to recoup faster, and I'm going to be feeling better and better. And that's what life's about. Because I have, in the autumn, my daughter is getting married, and I want to be with her, and I want to walk down the aisle with her, and I want to have a nice party, or because in November I'm having my anniversary, and I want to spend it in a resort. I want to treat my wife to a beautiful resort and spend a week or something and go to the spa and have nice dinners and watch sunsets, etc. That's what life is about. And I want to be in good shape. I want to be in good condition. But you know what? We medical doctors, in a way, I feel, are part of the problem. Because we have been so focused throughout my professional life. I don't think there is an instant when we're not thinking of how to deal with this disease, how to treat this illness. And sometimes you even get a little bit tired of talking of this, not because it's not important, but because I don't see any advancement. I mean, we sit and talk, and then we say about this patient with this thing and this patient with that thing, but we never talk about, wouldn't you love to be doing something to prevent it altogether? And you say, well, you know what? Diseases like cancer are the result of a very complex chain of events, from genetics, what family you're coming from, to which is your lifestyle. And many times your lifestyle is not exactly what you want, it's what you can afford, it's what's being given to you. And you have to put up with it. So, and the other thing is what I eat. And we go back to the same problem. Many times I do not have the money to do what I want. But on the other hand, and that's what I'm going to be talking about all this program, is that not necessarily we're doomed. There are many things we can do, and there are many things we can replan our life. So, but this complex condition of cancers, of the origin of cancer, has put us in a situation where we think that cancer is fate. It's imprinted in granite. If I'm going to have cancer, I'm going to have cancer. There's nothing I can do to avoid it. There's nothing I can do to treat it unless what the doctors tell me. I cannot help in any way. All I have to do is put myself in the hands of the best physician I know and follow the doctor's orders. That's the way we see medicine today. And in doing that, we have completely lost a very important fact, that cancer, as complex as it is, it depends a lot in what we do in our lifetime. Yes, genetics can play an important role, but doesn't mean you have to have it. Because genetics, on one hand, you have genetics, which is, the transfer of certain biochemical, metabolic information from parents to children. That we know, that we understand very well. My father was diabetic, he's going to transfer the gene to me, I'm going to be diabetic. My mother was blonde, I'm going to be blonde. My father had dark eyes, I'm going to have dark eyes. And I'm glad I touched on that, because I'm going to tell you something that we all have seen. And you say, oh my God, this beautiful child, so blonde, blue eye. And then you meet the parents and you say, what happened here? It has happened to you, I'm sure. It has happened to you that you meet somebody who does not seem to match their parents. That tells you that genetics can be tricky. Many times when you go back, you say, oh, his grandmother was like that. So the genes jumped one full generation, if not two, to set in this other individual. And that other individual was very tall, was very dark, was very thin. It was something that the rest of the family apparently doesn't have. How many times you have seen a father and mother that are very short, nice, beautiful people, and they introduce you to their son, and it seems to be like a giant. Oh my God, where this boy came from? Well, it happened that the grandfather of his mother was very tall. And that gene jumped 2 generations altogether. And same happens with cancer, same happens with diabetes. You don't have to have it. You have the gene, but you can block its expression. And that's called epigenetics, which is how you can modify the expression of a gene by making changes in your lifestyle, in the way you live, in the way you eat, in the way you exercise, etc. The way I live can modify the expression That's a word geneticists use of the gene. In other words, you have a gene, if it doesn't get expressed, you don't get that. Your mother can be blonde. You get the gene of blondness, but you not necessarily are blonde because either somebody in the previous generation or on your father's side didn't have it, and that's the gene that's going to be expressed. So you're going to be a different color of hair. However, you being dark hair can have a child that now is blonde because that gene from your mother jumped a whole generation and expressed itself in your children. You follow me? It's God's work. So it's not as simple as doctors and scientists want to make us believe that 2 and 2 is 4. No, it's not mathematics what we're talking about here. We're talking about the hand of God working on our bodies. So yes, I had family with cancer. I have to double my effort to make sure that my epigenetics blocks those genes. I want to make sure that by epigenetics, I can block the diabetes that seems to be coming to me, or the cancer, or the heart disease. I know families that all of them died of heart disease. You probably know some families where the father, the son, the grandson died of heart disease or suffer of heart disease. But somebody in the family destroy those odds just by changing the way they live. So let's begin with that thought. Let's begin that we're not doomed. Let's begin that fate, it can happen, but it cannot happen. It depends on how we deal with our lives, how we manage our lives. In one word, and this is the most important thing, I don't care what your doctors tell you. I don't care what anybody tells you. God gave you the power to change a lot of negative things and turn them into positives. The same way we push our bodies many times to a negative side by drinking and smoking. But if I take care of my body, if I BioCare my body, I'll be able to beat the odds. Let's stay together. I'm back with you, and I'm very excited because I'm trying to transfer a message that to me is very important. And that message is from Dr. Rodrigo Rodriguez that we really have a lot to do with our health scenario, with our health future, with how we control our diseases and how we can keep our health. It's a matter of being educated, knowing more about what we can do for ourselves, because after all, we're dealing with the person that we love hopefully the most, which is myself. So we are coming to you through Truth Be Told Radio Network. And again, I'm Dr. Rodrigo Rodriguez, and I'm going to be with you every Friday night, 7 p.m. Eastern Standard Time, and repeating this program every Saturday morning, 9:30 a.m. Eastern Standard Time. But the same thing, go to any of these, your social media of your choice, go to Facebook or Twitter, or Instagram, the one of your choice, we're there. And please, give us a like. Tell us that you like what you're listening. Tell us that you want to listen to more. And also, feel free to ask questions. Because we're talking about educating ourselves. And like, for example, when I gave the program about sleep and melatonin, I got questions from people in Europe because they have a lot of problem with these situation with melatonin because they have very short days in the winter time. So we can talk about it. And you can disagree, but let's talk about it. And you might convince me, and I might convince you. So it's very important because that interaction will educate us both. So we're talking about how medicine has focused so much on illness, and in this particular case on cancer, when you have an acute disease, that we have forgotten that we can do a lot of simple things to improve the situation. When I was a medical student, and I'm talking about long time ago, I was in medical school back in the 1960s. It was the time of the Vietnam War. Many of you might still remember, if not were there. It was the time also of the race to get to the moon. And in the United States, in Houston, they were trying to choose the person that would man some of those missions. They would have to get in a rocket and get I don't know how many gravities and be without, with very funny food, very funny drinking, very funny waste management, etc., for in the beginning few days or few hours around the Earth's orbit, and then planning to go to the moon. So it was not like take your average guy and say, hey, come here, I'm going to put you on a rocket, I'm going to send you to the moon. No, you had to have people that were in top shape, not only mentally, not only in preparedness of technical things. Most of them were engineers, pilots. All of them knew how to manage an aircraft and they had important studies on mathematics. And I remember, many of you might remember a magazine that was called Life. And I remember reading through this magazine and with pictures of all the men they were selecting, because they had all the credentials, smart and intelligent and a lot of knowledge in certain technical areas, but also they had to be very, very, very healthy. And I cannot underline it more. They went through every single test to make sure they didn't have any compromise health-wise to do that trip. And in fact, that situation helped us to begin to understand what health was. Because up to that date, doctors were very worried, as they are today. Let's face it, contemporary medicine is about dealing with critical cases. I have seen many people that got to the doctor and they said, well, what happened? Well, they told me that, yes, I have some little problems, some little high blood pressure, some this disturbance, but still, there's really nothing they can give me. Come back a year later, if I'm worse, they will start a treatment. That's true story. Okay? So many times you go to the doctor, and unless you really have something critical, the doctor is going to tell you, oh, it's in your head, go and take a vacation, I'm going to give you an antidepressant and that type of thing. Because we don't worry about healthiness. We worry about illnesses. And the more critical, the better. That's why we have such beautiful, huge hospitals. And they're fantastic and they're very good if you're very sick. But health is not their forte. And I remember that I was in medical school in Mexico City, in the largest university of the country, in what was then considered the best medical school in the country, and we had a visit of few of the doctors from Houston. And they gave a conference. And I distinctly remember their words. This doctor was telling us that we were being trained in how to diagnose disease and how to treat disease. And he told us, but when it comes to health, you know very little. You cannot tell if a person is really healthy. You can tell if the person doesn't have any symptoms, but you don't have any elements to judge if the person is really healthy. And he was true. If you're diabetic, your sugar is going to go up. If you have this risk, your cholesterol is going to go up. If you have cancer, certain tumors are going to go up. But if you have a healthy person, no symptoms whatsoever, where do we start to make sure that in reality that person is healthy? And actually, as I was telling you, that time in medicine changed a lot of things because we started looking at the human body under a different light. We had to make sure that that person was healthy, was functional, and even without any symptoms, we would have to be sure that the person was healthy. Not only that, but that was also the times where we began with the early warning symptoms, early warning signals that something might be wrong. And we started looking at medicine under a different light. If somebody comes to me, I want to make sure that person is truly healthy. I want to make sure that person doesn't have a real threat, something that in the future is going to give us a problem. And we started focusing a lot more in what I was talking about previously, the genetics. What is your family like? How, what has they have in terms of health issues and so forth? Because we know that many illnesses not necessarily are genetic. Let's clarify that too. It doesn't mean that you inherit it. It means that usually families that live together, eat together, watch TV together, do a lot of things together that might be unhealthy. So we see illnesses in certain families because they share lifestyle, not because they inherited it. And many people say, I have heart disease, my brother does too, and my other brother does too. It might be lifestyle a lot more than genetics. So you have to think of that when you think of your own health issues. And what I'm saying is you have to begin doing that. You have to begin analyzing your own life. You have to be analyzing what happened with my family, what happened with my brothers and sisters, with my mom and dad, what happened with my grandparents. How far can I go back and find out what diseases were around because I might be able to prevent them? You see? Then all this knowledge will help me then to continue understanding. How am I going to deal with my life? How am I going to deal to improve my health? And how am I going to deal, or rather deal, I would say, how am I going to manage to be within that 40% of people that will not get cancer because of their lifestyle changes? And I'm not saying that. It's the Center for Disease Control and Prevention. They have added that word. The CDC is now Center for Disease Control and Prevention in Atlanta, in Georgia. But there are many other studies around the world, many of them from prestigious universities and research centers in America, that tell you that between 30 to 40% of all causes of death can be prevented by simple management and improvement of our lifestyles and supplementation and physical activity. How much money am I going to invest? How much money am I going to invest in eating better? How much money am I going to invest in walking around the block? How much money am I going to invest in keeping track of my physical activity versus the food I have as an intake? How much am I going to invest in choosing a piece of fish instead of a processed food? It's simple. It's inexpensive. It is very possible, but the big problem is it will not work unless you make the changes. Only you can make the changes. See, your doctor can advise you to have more exercise. Your doctor can advise you to eat better. Your doctor can advise you to eat less. But if you don't do it, if you don't help, if you don't get at the helm and start making all those choices, all those healthy choices, you're going to get nowhere. And you continue on a path of self-destruction and disease producing. You don't want that. You want to be in that 40% of people that bypass deadly diseases. Don't go anywhere. We have to continue talking. My friends, I'm Dr. Rodrigo Rodriguez, and this is Truth Be Told Radio Network. And we're only, not only through weekly broadcast, Friday, 7 p.m. Eastern Standard Time, and Saturdays, 9:30 a.m. Eastern Standard Time, but we're in the social media of your choice. And I asked you before, and I'm going to ask you again, to please join us, to follow us, to be with us, because we have to create a community that wants to improve their longevity, their well-being, and their health, not only for ourselves, but also for everyone that's around us, our spouse, our children, our co-workers, our church members, etc. We just want a community that's healthy, that enjoys life and takes advantage of everything that health can bring. And we're talking today about, in particular, about cancer, but we're talking about cancer under a different light. We're not talking about, well, you have cancer of the breast, we have to do this and that, because there's a lot about that. But nobody's going to tell you that cancer can be prevented, that you don't have to get it, that there are many things that you can do that are going to hopefully help you to bypass it. That the Center for Disease Control and Prevention in Atlanta, Georgia, tells us that about 40% of overall cancers will be prevented, can be prevented if we just make lifestyle changes and health preventive simple measures like changing in lifestyles, changing in what we eat, changes in how we supplement our life, etc. And that can make a big difference. So that's what we're talking about. Cancer can be prevented. But also cancer, when you have cancer, it brings a big burden. And that burden is in pain, in inflammation. Inflammation and pain are always go together. Inflammation means pain. And it brings so many things around it. It gives you pain, discomfort, disability, nausea, lack of appetite, tiredness, fatigue, depression. You cannot go to sleep yet you're very sleepy. There's so many things that can happen that you can begin to help right now. First, let me tell you that there is a very strong association. And this is very important because we're seeing the numbers, and when you look at the numbers, they're really a dismay. I mean, it's getting worse and worse and worse. But all cancers and heart disease and diabetes and all high blood pressure, etc., you name it, are diseases that are associated to all the metabolic syndrome that's associated to overweight and obesity. And we are a society that has forgotten that there has to be an energy balance. This is very important. Very simple, but very important because we never think of that. There has to be an energy balance between our caloric intake, which is what we eat, what we bring into our body, and our caloric expenditure, which is the calories we use to do things. And nothing spends more calories than physical movement. Every time you move a joint, every time you move a muscle, every time you move your body, you get up of a chair. I mean, you're lifting pounds of the chair, pounds of the bed. You do errands and you bring all those 150, 200 pounds, whatever, all around the market, and that uses energy. You see, but if we don't use that energy, our energy expenditure is going to be very low in comparison to the energy income. So we're talking about energetic balance here. Very simply, what I eat versus what I do. And I talk to people, and every time I get this idea that people give me, and they say, "Doctor, I've been gaining weight because I cannot go to the gym because it's very far away, and gas prices are going up. So I'm looking for a gym that's closer to my house." Who on earth told you you need a gym to spend energy? Who told you you need a gym or sneakers to spend energy? Now, if for any reason I were in an accident, I had a bone fracture, well, I cannot move as I used to move. That's understandable. That I can believe, not the other one. This one I can believe. No, you cannot move well. Who told you that if you're not moving as usual, you should be eating as usual? We go back to the energy balance. I broke my leg. I cannot walk for, doctor told me to be off my feet for 2-3 weeks. Well, I'm going to eat less and less caloric foods. I'm going to have salads. I'm going to have steamed rice. I'm going to have fish, grilled fish. I'm going to change the way I eat because I will not be able to get rid of those calories. And you and I know very well where those calories are going to end. And we're going to increase the size of our tummies, the circumference of our tummies, and that is fat with metabolic activity. That's a fat that's very inflammatory. And then we start a chain reaction. We're eating more of what we expend. I mean, you see a bricklayer or you see a laborer in the field, he looks thin. And then you see him eating and he probably eats a lot. But he keeps a balance. Keep this in mind. I want you to put this on your brain. You have to have a balance between what you eat and what you spend. Now, you want to eat more? Well, let me tell you, 1 pound of spinach is about 5 grams of chocolate. So take your pick. If I'm going to have a chocolate, I'm going to have only one. If I'm going to have spinach or lettuce, I can eat a lot. Arugula, I can eat a lot. Broccoli, I can eat a lot, weight-wise. Whereas if I have other things, watch it. What if I have ice cream? That's fat with sugar. That's a huge amount of calories in a scoop of something. I mean, you're having the calories of a full meal. Well, that's all right. But then you go out and mow the lawn and take the weeds out of the garden and paint the fence or do something where you're going to spend those extra calories. I would not advise you to have ice cream because it's bad fat with refined sugar. We should not use that. We should not eat that. That should be off limits. Okay? But if you do a higher caloric intake, then increase your caloric expenditure. In other words, you have to keep a balance between what we do and what we eat. It's simple, it's basic, and I don't think nobody has ever told you, much less a doctor. We tend to say you need to do exercise or you need to eat less. We never put the two together. You have to do it. Because you know what you did at home. You know what you did at work. And in some of the programs, we have discussed that one of the few ways to increase your energy expenditure. Take the vacuum cleaner off the closet, move the furniture, take everything out, move it, leave it sparkling clean, bring down the drapes and wash them and then put them on a hanger. Don't use the dryer. Just put it outside and let it dry with the air and the sun and bring them back and use a steamer so they look beautiful and nice. And all that counts. All that is energy expenditure. That's what our grandmothers did. They walked to the market, they brought a basket with things in their arm, and they got home and they cooked and they ground things and they cooked for a couple of hours, if not more, and then they had to do the dishes and they had to clean the kitchen, etc. And then they went and did the laundry and ironing. They were spending a lot of calories. They could afford to eat well. But right now, what we do, we get up at the sound of the alarm clock, we take a shower, then we're tired. Because that's really what we do. We jump in our car, sit in our office, go to lunch and eat as if we had done a lot. And then we go back, sit at the office, go home, sit at the couch, watch TV for the rest of the evening, and then what? Then we have a big dinner. Where's the balance? Nowhere. If you want to keep a good message today, if you want to give a good advice to someone you love today, all you have to do is say, you know what? We have to try to keep a balance, an energy balance between what we do and what we eat. That in itself is probably one of the best ways I have found to put it, because it can be life-saving. It can really change your life. And all you have to do is print it and put it in the fridge, in your kitchen, in your pantry. Keep an energy balance. Simple. What I eat equals what I spend. Let's keep on talking. Getting interesting. My friends, I don't know about you. I have had a ball talking about all these things because that's what I do. I'm Dr. Rodrigo Rodriguez, and what I love to do is research and look for answers and see what I can tell you to do. It'd be very simple to say, well, my friend, you have a problem, go to the Mayo Clinic. Go to Houston, go to Sloan Kettering. Well, you probably did already. If not, you already went to your hospital, you went already to your doctor. I'm not telling you anything new. And the most important thing, I think, these advices that we're giving to you are simply inexpensive and effective. That's the most important part. I was telling you, for example, that cancer patients, because of the inflammation and because of the side effects, many times side effects of the medication they're getting or radiotherapy or whatever, they go through a difficult time. And any of us that have dealt with a person with cancer knows what I'm talking about. But when you think of what can I do with this person? How can I help this person? And you say, well, you know what? There's a very simple thing to do. Very simple, and that's physical activity. Why physical activity? Because in our life, and you see, and this is to me very important to share this message with you. To me, it's very important. It's very important because it's very easy to say you have to exercise, and yes, it's good for me, and that type of thing. But I'd like to give you something more convincing, something more explanatory of why physical activity is good for us. What I was telling you is that I would love to give information that makes it a lot clearer of why physical activity helps. It's like spinach or broccoli. Our mother and everybody says it's good for you, but nobody tells you why. Same with exercise. Physical activity is good for you, but nobody tells you why. Well, it happens that life in itself produces a lot of chemical reactions, a lot of oxidative processes, a lot of immunological, hormonal, etc. interactions in the body. But if we make an analogy with the car, when we run our car, on one hand, yes, we have performance, we have horsepower, we have a lot of things, but on the other hand, we have an exhaust pipe that's sending toxic waste out of the engine because energy-producing mechanisms produce waste. Number one. Number two, because every time you move your car, you're going to wear some of the parts that eventually will have to be replaced. That a lot of these movements in the car will need lubrication. Well, the body is the same thing. We produce life and heat and life in general, but we produce waste material. There are things in the body that we have to get rid of. And there are things in the body that we have to replace. And there are things in the body that we have to lubricate. So when we exercise, the first thing you notice, and you can tell, is that your heart rate goes up. If you have a pump with a higher rate, what can you expect? A higher output. So you have more blood in circulation. And because it's a circle, it's a closed circuit, what's going to happen is that the blood is going to go faster. You're going to have a higher blood flow. And by getting a higher blood flow, you're delivering more oxygen. You're delivering more lubricants in the form of essential fatty acids. You're sending more parts and tools to repair the cells, to repair the organs. You're changing as you go. You're changing the parts that have been damaged. You're sending a lot more of oxygen because not only your heart is beating faster, you're breathing deeper and at a quicker rate. So all that translates in a bigger output of resources to the body, but also that blood is going to be able to recover and bring out of the system all the waste material. The carbon dioxide that's going to be expelled in your respiration, and a lot of damaged protein and things that are going to go through your kidneys or through your liver. So when we exercise, we set so many things in high gear that when we finish, we might be a little bit tired, but we say, I feel a lot better. Of course, you gave your body a lot of tools and you remove a lot of the toxic waste. Is it difficult to understand that exercise is good for you? But we're talking about a cancer patient. Well, that cancer patient needs to repair a lot of things. Cancer patients produce a lot of toxic waste. So that has to be part of it. And if I simply move more, even if you cannot walk, even if you just pedal in some of those little gadgets to pedal while sitting down, even if you just lift something up and down with your arms, even if you just do something like that, that increases your heart rate and your blood flow. And that's going to improve your condition. That's what we do at BioCare. That's why we have a track record of 30 years, over 35 years now, of excellent results. Because we have, from the beginning, considered a lot of those things. When I started on the way of alternative medicine, I met people that were doing things that in the beginning I could not understand well. And I'm talking of Dr. Krebs, I'm talking about Kerry Reams, I'm talking about people that work in Germany with LifeCell, which is the antecedent of stem cell therapy. I met people that were working with many possibilities to help the human body. And let me tell you something. Many of those things I didn't fully understand why, but I knew they worked. And I implemented programs. I implemented cancer programs for BioCare Hospital. And as I have gone, I understand more and more of why they work. But they do work. And if you have any questions, please don't hesitate to contact me. I have so many years here that sometimes I'm surprised to remember all the names of all the pioneers which I met personally. Because when I began in this, I was very young. So I had the opportunity to start young in this quest. But even in the best case scenario, having cancer is not a nice thing. So I want you to prevent. But if you happen to be suffering the ravages of cancer, even if you're not suffering, if you know you have cancer, BioCare can be a big part of your answer. We're here to help you. I want you to call me. I want you to tell me what's happening. I can give you a ton of advice that's going to cost you nothing, or I can tell you to come to the hospital and kickstart a good metabolic program that's going to bring back things together and you're going to feel a lot better. So when you choose to BioCare, a lot of possibilities are going to open up for you. When you choose to BioCare, and you can BioCare beginning today. If you start analyzing and rethinking some of the concepts that we have been able to discuss today. And in any case, I'm going to continue talking about this. I'm going to continue talking about this until I die, because I want to share what I know. I want to share what I research. I want you to know that you have a lot of possibilities, and that if you need a place to start and kickstart everything that I'm talking about, you have BioCare Hospital. And you can call, ask a question, send us your laboratory information, tell us about your history, and we'll be able to talk to you. You can go to YouTube and share many patients' experiences. I get delighted when I see people like today. I saw a patient from Alaska that has come several times for several years and continues to do well. So you can be helped. But it depends a lot of what you want to do for yourself or for the people that you love. If you have a cancer patient in your family, there are a lot of things that you can do to help that person. With your love and patience, you can induce this person to do good things for themselves. So that's what I have to tell you today. And I hope that you follow us, that you join any of our groups, that you call and ask a question, that you choose to BioCare. Because if you choose to BioCare, again, you're going to open many doors for you. Everything is possible. We'll see you next week.